How does sleep apnea cause nocturnal hypertension? Have you ever wondered how sleep apnea might affect your blood pressure while you sleep? Let's break it down and understand the connection between sleep apnea and nocturnal hypertension. Sleep apnea, especially obstructive sleep apnea, leads to episodes where the airway gets blocked during sleep. This blockage can happen partially or completely, causing your breathing to stop and start. When this occurs, your body experiences drops in oxygen levels, a condition known as intermittent hypoxia. This drop in oxygen triggers your sympathetic nervous system, which is responsible for your body's fight or flight response. When activated, this system causes your blood vessels to tighten and your heart rate to increase. Both of these reactions raise your blood pressure. This effect is particularly strong at night, leading to what we call nocturnal hypertension, or high blood pressure during sleep. Moreover, intermittent hypoxia activates a hormonal system called the renin-angiotensin-aldosterone system. This system helps regulate blood pressure and fluid balance in your body. When it gets activated, it promotes sodium retention and further constricts blood vessels, which adds to the high blood pressure during the night. In healthy individuals, blood pressure usually dips during sleep. However, in people with obstructive sleep apnea, this normal dipping is often absent or reduced. This results in a pattern known as a non-dipper pattern, which is linked to a higher risk of cardiovascular problems. Another factor at play is the frequent awakenings caused by sleep apnea episodes. These interruptions lead to sudden spikes in blood pressure. Additionally, the body's ability to regulate blood pressure, known as baroreflex function, can become impaired. This leads to increased variability in blood pressure and sustained hypertension during the night. The effects of sleep apnea also include inflammation and oxidative stress, which can damage the lining of blood vessels. This damage contributes to increased stiffness in the arteries, further raising blood pressure levels. Interestingly, if someone has resistant hypertension, which is high blood pressure that does not respond well to treatment, it can worsen sleep apnea. This creates a cycle where each condition exacerbates the other. To manage nocturnal hypertension in individuals with sleep apnea, treating the underlying sleep apnea is essential. Continuous positive airway pressure therapy is a common treatment that helps keep the airway open during sleep. This therapy can help lower blood pressure, although it may only do so modestly. In addition to using continuous positive airway pressure therapy, healthcare providers may prescribe medications to target the sympathetic nervous system or the renin-angiotensin-aldosterone system. Lifestyle changes, such as diet and exercise, may also be recommended. In some cases, procedures like renal sympathetic denervation could be considered to help reduce blood pressure and improve sleep apnea symptoms. Understanding how sleep apnea causes nocturnal hypertension is vital for managing both conditions effectively. Addressing sleep apnea can lead to better control of nocturnal hypertension and reduce the risk of related complications.